Well, some good news. As the Nigerian Association of Resident Doctors has suspended its planned nationwide strike earlier scheduled to resume on January the 12th. A decision followed an emergency virtual meeting of the association's National Executive Council to review progress on its demand. NARD says the suspension is strategic, pending further assessment at its January the 25th NEC meeting and not connected to a judgment from or a ruling from the industrial court. The association confirmed receiving firm confirmations from commitments from key ministries and government agencies after the intervention of the Vice President Kashim Shettima. The resident doctors had threatened there's a strike over welfare, allowances, and working conditions, while a court order had also restrained them from industrial actions. I'm now being joined by Dr. Mohammad Suleiman, President, Nigerian Association of Resident Doctors. Thank you for joining us.
Thank you for having me.
Okay, so good news, because over the weekend, a couple of people had gone to the hospital, and we do know that some other health workers are currently on strike, especially in the FCT. So that in itself is a problem. So if NARD had gone ahead with this strike, it would have been an added pressure on Nigerians who are seeking healthcare, especially in the FCT. But what happened? First, we hear there's a court injunction from the industrial court that you guys are barred from going on any industrial action. And then suddenly you're suspending the strike. What happened?
Thank you for having me. Good evening to our viewers. From Tuesday last week, the Minister for Labour and Employment called for a conciliation meeting between NARD and the Ministry of Health. And we had robust conversations. Following those conversations, we had letters coming out specifically for promotion areas for medical officers. These compilations were transmitted to the Ministry of Finance. And then on the same day, compilations for salary areas for 4 hospitals, OAUTH Ile-Ife, FMC Owo, UUTH Uyo, and FUTH Tupo, were forwarded to Ministry of Finance. On Wednesday, we had another engagement at the Federal Ministry of Health, and then we talked about committees that has to do with locum employment policy. We also talked about the committee on excess workload, the work hour problem that we have. You know, we have doctors that are constantly on call every day, which is not sustainable. And then we had progress on that line. On Thursday, we had further conversations, which finally agreed to allow our members in Lokoja back to Lokoja. And the Ministry of Health has taken up processes for conciliation and for formal communication back to the hospital over in Lokoja. Now, this was in the backdrop. You had well-meaning Nigerians, senior members of the government, making calls, urging government to move on, urging NARD to also be at the discussion table for all of this. And then Friday, towards the later part of Friday, we saw on social media that there was a court injunction against NARD and its leaders and its leadership. And now, when we went for the National Executive Council meeting, we took about 4 hours debating some of these movements from the government side. And I can tell you the court injunction never surfaced in the conversation because progress had already been made even before that had happened. Now, juxtapose that against the intervention of the number 2 citizen of the country. I mean, when you're crying and then it is your father that is coming to say, stop crying, I will handle what your issues are. You're already on the front burner of the conversations. And then the NEC sat down, looked at it and said, yes, we trust the word of the Vice President. And then that word has been backed by action, and we would hope that the action will continue. However, the NEC is very particular about the timeline of 2 weeks, so that some of these things, because basically they are in the final processes of being implemented. We are in discussions with the Ministry of Finance for the professional allowance table to be implemented this month and be captured in the budget for these promotion areas I just mentioned, for the salary areas I just mentioned. We're in discussions with the Ministry of Finance for a payment plan. And then with the intervention of senior members of the government, the Vice President specifically, we hope.
It's really interesting to see that almost all your demands, and I say almost all because I know that there are some that you have put aside for now, but the one you mentioned about the excess workload, wouldn't that be your own fault? I mean, the members of NARD, a lot of you are leaving the country. You're jackbuying. So if those of you who have chosen to stay are given more work to do, I'm sure you'll be asking for compensation for that.
Yes.
But how about encouraging your colleagues to, like you, stay back, knowing that we need to build our health system?
So there are factors that pull and push people in and out of the country,
which is normal.
In 2014, we had about 16,000 resident doctors at the federal level. At the state level, 7,000. In the whole country, about 25,000. Today, by our own records of our own membership and payment platforms of federal government and state governments, we just have less than 11,000. In 2024, about 4,700 doctors left the shores of Nigeria. Perhaps by the end of this month to February, we will know what the number is for 2025. Now, there are several things. Excess workload is one of it. It's not sustainable for a doctor to be on call every day for the entire month. And we have brought forward examples of this happening everywhere. Doctors have lost their lives on this. Now, several other factors complicate this. You have stagnation in professional advancement. You can see we're struggling about promotion areas way back till 2020. We're still discussing the membership certificate issues. So you have excess work. You have to struggle. You're not being promoted. You're not being compensated. You have to struggle to get your own right. You have to scream at the top of your lungs for your own professional recognition to be handed over to you. So this adds to frustrations. And countries outside Nigeria readily offer this. And we know the economic realities of the country. We know the security situation of the country. And then this contributes eventually in doctors leaving the shores of this country. As an association, two things are important. If doctors are not frustrated, exhausted, angry, and underappreciated, they will give out their best to the patients.
Let's look at, because Nigeria is considered one of the best training fields for medical doctors in the world.
Exactly.
I mean, when Nigerian doctors are stepping to the US or the UK, and even in the Asian countries, they are grabbed because they know that, one, in terms of work ethics, you have it, professionalism, it's there. So what are the things? At this part of the demands you're asking for, work conditions, and because we do know that every year doctors graduate from the Nigerian universities, both private and public universities. Is that also part of the things you're demanding for? And what's the traction on those demands?
Okay, first of all, I gave you a figure of how many doctors left Nigeria in 2024.
Yeah, about 4,000 plus.
4,000 plus. And
we don't know how many left in 2025.
Yes. In a year, Nigeria graduates 2,000 to 3,000 doctors. And if you look at the net migration, we're actually losing more. So what is the problem? We are the best. Nigeria produces the best, but we now ship out this best outwards. What we are asking is, especially for the work hour, if you go to the UK, 48 hours a week is the cap. Anything more than 48 hours, your supervisor has to explain why and account for it, either compensate you with remuneration or with holiday, to compensate for that. In Nigeria, you give over 100 hours as a resident physician. As a resident surgeon, you give over 120 hours per week. If you stretch that out, that is 5 to 6 days in a week that you are in the hospital working to save lives. At some point, it plays. You're tired, you're exhausted, it plays on your decision making. Complex cases come to these institutions that have resident doctors that require you to be at the top. At some point, you will make a mistake. And then when we make these mistakes, we're not forgiving. The system actually catches you, gives you the appropriate punishment, and then that adds to the frustration. What we're saying is government needs to sort out these issues so that it is better for the patient. It is better for our own people. And I can tell you, if work hour is corrected, we have colleagues that are ready to come back to the country to serve its nation.
If the work hours are worked and the conditions are good. What about in terms of graduation? I do know that some of those that are supposed to graduate are frustrated within the schools for one reason or the other, and sometimes victimized. Would that also be part of the things you'll be looking at going forward to ensure that their rights are not thwarted, so that they are not frustrated and opting out, so that we can have more doctors coming out?
Well, at this point, I must commend government, especially the Minister of Education, Tunji Alausa. I think he has brought forward novel ideas. You may have your reservations about the ideas, but they're looking at doubling the numbers that are being graduated from our universities. I mean, you could criticize it, but that is government taking initiative. Now, when the numbers are more, it is hope. The hope is that they will stay, but these push and pull factors are still going to be there. If you talk about victimization, I mean, any system has those issues here and there. I trained in Nigeria. I trained in ABU Zaria, and I can tell you it is the best of trainings that you can get. We're proud of the training our teachers give us here. We're proud of the government setting up, however inadequate it is. The system still produces the best, that wherever you go in the world, you're recognized as such. We only hope that the ones we are producing are retained back in the country.
But this is like the last question I'll ask here. A lot of Nigerians just don't like to hear how no matter how germane the conditions, I mean, the issues you've talked about are, just don't want to hear that doctors are going on strike. I mean, what happened to your Hippocratic oath? That's what a lot of Nigerians will say. So what's the guarantee that maybe, let's just say, for the next 2-3 years, we will not hear about NARD going on strike?
We tried that.
Yes.
We tried that. From 2022 till last year, NARD was never on strike. And then these issues kept piling from 1 to 2 up to 19.
But do you even go on strike for conditions in the hospitals?
Yes, we do. In fact, it's in our conversation on the table now. Infrastructure is a very, very key issue. Now, let me put it this way. The Hippocratic Oath encourages you, gives you that lifeline to save lives. But it also tells you, physician, heal thyself. Now, if you juxtapose these two things, it means you have to be sane, you have to be healthy for you to give out the best. The situation we're having in Nigeria is that in the next 10 years, 10,000 more doctors could leave. And then those that are left behind, I'm not going anywhere, those that are left behind will have excess more work to be done. We're only shouting at the top of our lungs now for government to recognize that we're heading into that ditch. It's a disaster. It's heading at us. We must do something to check it. It is not just for the doctors. It is for the good of the Nigerian patient.
Thank you so much. We do appreciate this conversation. Thank you, Doctor, for coming in, and thank you for speaking with us. We do hope that all of these things will be sorted out real quick so that we can walk into the hospitals and be at peace. Not just rushing to the private hospitals, even our public hospitals. Yes. Thank you so much. And do take care of you. I heard that you weren't feeling too well and you still had to come into the studio.
Yes.
We wish you quick recovery.
Thank you very much.
Thank you. Thank you. We had Dr. Mohammad Suleiman, President, Nigerian Association of Resident Doctors, here in our studio. Thank you once again.
Thank you.
Well done.